a low-risk setting. And we have to remember, schools continue to be a low-risk and safe setting. So there are many other measures that make it safe to make sure that you have opportunities when children and young people are sitting at their desk, when they're doing work at their workstation, regardless of the exact amount of space they have around them. Those are not high-risk situations, and those are not where we're seeing transmission in classrooms, and it is aligned with what we are doing in every other sector. And I will say as well that, you know, we are learning, and young people are learning how to wear a mask appropriately, how to take it on, put it on and take it off appropriately. It's more challenging for young people, and it's all of us that need to encourage and make mask wearing part of the normal aspects of our school, but we should not be shaming and blaming either children who are wearing masks or not wearing masks. And we need to make sure that we have an environment that is healthy and safe for all children and the adults in our school system as well. So this is something that has been a progression. We've been supporting that attitude in classrooms from the very beginning, and it is working. It's effective. It's one of the measures that is effective.
Nick.
I just want to add something quickly too about the level of anxiety. I do want to remind folks that we have over 90% of our students back in class full time, and we don't hear those stories. So we do know, to Minister Whiteside's point, that there is anxiety out there, but I think we also need to start talking about the fact that we have 90% of students, approximately, back in classroom full time, having face-to-face instruction and receiving all the services that education and full-time face-to-face instruction provides them. So we do have a number of families who are feeling okay sending their kids back to school, and we're really grateful for that honor that they give to us every single day.
Next question is from Shannon Patterson, CTV.
Oh, hi there. I'm not sure if this is for Dr. Henry or for the minister. If students can take their masks off when they're at their desks or at their workstations in the classroom, to me, this new mask mandate doesn't really seem like a change from the old order. So maybe I'm missing something. Can you give me a couple of specific in-school examples of where a student will now have to wear a mask when they didn't before?
Well, I would say when they will be required to wear a mask when they're entering their classroom or learning space, if they are engaged in any sort of group work or discussions, if they're getting up from their desk to move to get a drink of water or to do anything, to move around the classroom, and that those provisions are consistent with I think what we see in office workplace settings for example.
Shannon, do you have a follow-up?
They said that PE should happen outside whenever possible. My child just went through PE, and sometimes the weather was very, very difficult, and they were still inside the gym. So my question is, can PE still happen inside the gym, or is that now off? Because you said whenever possible. And if you can still do PE inside the gym, would kids now have to start wearing masks?
Do you want to take that one? Sure.
You know, if you read the guidelines, there's a lot of detail about that. But what we have recognized is that things that were being held outside safely, when they move into the gym, people were not necessarily taking extra provisions to ensure greater space, mask wearing in certain conditions. So yes, there is some guidance, some more detailed guidance about how to safely have PE classes without having the intense physical activity that you can do outside more safely than inside. So it again aligns with what we've learned over the last months about this virus and how it is more easily transmitted in certain months of the year as well as in certain indoor conditions in particular. So it does provide, the guidance is about increased space, reducing numbers in a larger space, and reducing the types of activities that are more risky indoors.
Ian Bailey, Globe and Mail.
Question for Dr. Henry, I guess. What's the latest data on transmission in schools in British Columbia? What can you tell us about that?
In terms of the numbers of people, we gave an update a few weeks ago. We have had a number of exposure events, but only one cluster that I'm aware of since then, so that's a small amount of transmission between a small number of students. As you know, we had a potential or an exposure event where somebody had a variant of concern in a high school, and all of the people in the cohort of that in that cohort were tested, and none of them tested positive. I will say we did both the rapid tests and the PCR tests to be sure, the PCR being more accurate. We did have one false positive on the rapid test, but it was repeatedly negative on the more accurate PCR testing. So we are confident that that again tells us that the risk of transmission with the measures we have in place in our classrooms is very low.
Do you have a follow-up, Ian?
No, that's fine. Thank you.
Thank you. Next question is from Lisa Houston, News 1130.
Hi there. Good morning. I'm wondering what is going to happen. I mean, you said, Dr. Henry, that you don't want shaming, but I'm wondering what happens if students refuse to wear it. I know there are rules for what happens if people don't do it in public, but what happens in a school situation if someone is just refusing to wear it?
You know, there are many reasons, as we know very well, why people cannot or will not wear a mask, and that's no different for students. This is educators know how to work with students, and quite frankly, we need to ensure that educators themselves and the adults in our school system are appropriately wearing masks, and that's the responsibility of the administrators in the school, and the principals, and the school district. But really what we know is setting the tone in the classroom and working with each individual student is what makes this an appropriate and a safe place for students and staff for wearing masks, and recognizing that there are some students, and we know that for sure, there are some students that are just not able to wear a mask, and making allowance for that as well. I don't know if you want to talk to that.
Yeah, and just further to that, I do want to reinforce that it is certainly not our intention that this becomes a punitive measure, or that there is a punitive response in situations where we need to work with, where at the school level, we need to have teachers and students and administrators working together to ensure that the school environment is safe. And that direction is written into the guidelines, and we will be supporting our districts in any way necessary to ensure that this sort of rolls out in a way that that helps and that is not punitive.
Follow up, Lisa.
I'm going to pull a Richard Zisman here, and I'm going to try a couple. I'm wondering, with the data, Dr. Henry, you said that we've seen it recently, but I don't think that we have outside of Garibaldi, and why can't we see it that specifically all the time? It seemed very clear there to show this many were tested, this many came back negative. And also, I'm just wondering about with remote learning, is there going to be no further direction for any of the schools as far as remote learning or PPE or what they need to spend their money on? I'm just wondering why no direction to them.
Maybe, Lisa, I can just address the last part of your question first. We will be releasing the second allocation of the federal funding imminently, and we have been, in fact, working with our provincial partners at our provincial steering committee over the last few weeks around where that money can best be allocated. We know that a portion of it certainly will go to continue to pay for the additional staff that districts hired, the hundreds of additional custodians, additional teacher psychologists, the additional counselors, the many staff that are more educational assistants supporting students with special needs. So we know that we need to continue to support those investments, but also on many other aspects of the plan, whether it is personal protective equipment. There's more work to do on other areas around ventilation and barriers, and we are working with our partners on our steering committee, and will support districts to make those investments. So there has been direction, but it's been a collaborative process because we've asked the folks who are closest to and working in our schools what is it that they need. And now I've forgotten the first part of your question. it was around data, which I will pass to you.
So as you know, the data on exposures, on clusters and outbreaks is posted on the health authority websites on an ongoing basis and also on the BC CDC website. And we routinely repost information about school age and the number of cases in school age children. And we'll be presenting some more information on that tomorrow morning.
Next question is from Yvette Brend, CBC.
Hi, yes. Dr. Henry, could you explain or can you describe for us the need for the rapid response teams? What will they be doing that wasn't being done before to help support schools, and what was sort of lacking or insufficient about the initial response plans?
Yeah, I think I don't assume there was something lacking or insufficient. It was more trying to find a way to enhance or better connect with schools and answer their questions in a rapid way. Of course, if you look back to November, particularly October, November, December, when we were having a lot of cases in communities, particularly in the Lower Mainland, but now we're seeing that in communities around the province, and it was a very challenging time for public health, and I had started a public health school.
Good morning. My name is Jennifer Whiteside. I am BC's Minister of Education. I am grateful to be with you here today from the territory of the Lekwungen-speaking people of the Songhees and Esquimalt nations. And I'm very pleased to be joined by Dr. Bonnie Henry and Stephanie Higginson, President of the British Columbia School Trustees Association. Today, we are announcing the enhancement of our health and safety guidelines for K-12 schools. This is part of our ongoing work to keep schools safe for students and staff. But before I begin, I would like to recognize the incredibly hard work being done throughout our province to support student learning. I've seen how this pandemic has turned the lives of British Columbians upside down. This year, all of us have faced obstacles really like never before. And throughout these many months, the people working in our schools, the teachers, the support staff, the school leaders, people in our Indigenous communities, parents and trustees have faced all of these challenges with such determination and compassion by keeping students and their health and well-being top of mind every single day. Schools are at the heart of our neighborhoods and communities, and they are the best places for students to learn and develop their abilities, their knowledge, their skills. There simply is no substitute for in-class learning. The BC CDC report in September 2020 told us that the suspension of learning in March and April had a profound and dislocating impact on the lives of many students. That's why it was a priority for our government to make sure schools could open in September with strict health and safety guidelines in place. And thanks to the hard work of education professionals, the vast majority of our students are attending school and receiving full-time, face-to-face instruction. Attendance rates for both staff and students have been consistently high throughout the first 5 months of the school year. And I've heard from many families that it means a lot for their children to join their friends and teachers in the classroom. And that's why keeping schools safe and open remains a priority for our government. We know that schools mirror what's happening in our communities. And while that means we've experienced exposures in schools, we are still seeing low transmission rates inside schools. This tells us that our health and safety guidelines that we have in place for schools are working well. And as the pandemic continues to evolve, and as we learn more about its behavior, our school guidelines must evolve as well. Throughout these challenging times, we have been meeting with our education partners, with rights holders, and provincial health officials regularly through our provincial steering committee. And since September, we've learned from our experiences, and we've worked collaboratively on how we can adapt. And as a result of all of this work, we are strengthening and updating our K-12 health and safety measures. Under the current guidelines, middle and secondary schools, as well as all K-12 staff, are required to wear non-medical masks when they are in areas of the school where interaction is not controlled, such as hallways, the library or lunchroom, or when they're on buses, or any time when they are not with their learning group. Our updated guidelines will now require all middle and secondary school students, as well as all staff throughout K-12, to wear their non-medical mask in all indoor areas of the school, including when they are in their learning group. The only exception to this is when they are sitting or standing at their seat or workstation in a classroom, where there is a barrier in place, or where they are eating, when they are eating or drinking. For elementary students, wearing masks while at school remains a personal choice for students and their families. It is critical to remember that masks do not prevent the spread of COVID-19 on their own. We still very much need the other layers of protection. We need to ensure students and staff continue to follow safety guidelines, including, very importantly, not coming to school sick, even with mild symptoms, washing your hands diligently, following all of the safety protocols in our schools and in our communities. We are also strengthening our guidelines for physical education and music classes. High-intensity physical activities should be held outside whenever possible. Shared equipment or items like weight machines, treadmills, or musical instruments can only be used if they are cleaned between use according to strict school sanitation guidelines. Students using equipment or playing instruments should also be spaced at least 2 meters apart, and masks are to be worn while singing. We must ensure our K-12 protocols are being applied consistently. And we also want to make sure students, their families, and staff feel confident with the safety measures in place, and that's why we're making these updates. I now just want to say a word about funding. In order to continue to support our safety plans, we are investing the second installment of $121.2 million in federal funding, which will allow schools and districts to continue to support students and staff until the end of the school year. To date, we've invested $288 million in federal and provincial funding, which has made a tremendous difference for students and staff. School districts and independent schools have used this funding to hire more staff when needed, to purchase masks and cleaning supplies and other personal protective equipment, to support remote learning, to improve ventilation and air quality systems. I do want to take a moment to address students directly. I know the pandemic has been very difficult for you. You've missed out on time with friends, time engaging in activities that you like, and everything about our COVID world really just feels different for everybody. And for older students, we recognize that this is not how you had envisioned spending your final school years. Your generation will be fundamentally shaped by the experience you're going through right now, and it is, frankly, unlike anything experienced by previous generations. But I do want to say, I think you've been amazing. And I want to encourage you to hang in there and keep taking it day by day, and we will get through this. In the meantime, we are committed to working together to continuously review and consistently apply our health and safety guidelines. And I do really want to express our deep gratitude to parents and families, students and staff, our education partners, and public health leaders. Our work is making a significant difference, keeping students safely in schools where their learning and well-being is supported. And I also just want to take a moment to recognize the excellent work that childcare providers are doing every single day to keep families and their staff safe. And there will be more detailed guidance available in this area next week as part of the BC CDC's updated childcare guidelines. And with that, I'd now like to introduce BC's Provincial Health Officer, Dr. Bonnie Henry.
Thank you very much and good morning. As I don't need to say, COVID-19 has proven to be a challenging foe for all of us, and our education system has experienced this at all levels. We know that in-class learning, however, and the opportunity for students to be in school is so important, not just for their education, but also for mental, physical, and emotional wellness. It is such an important part of growth and development for our young people, and we have put an important emphasis on that. And we know from the surveys that we've done that it was very disruptive, not just for students, but for families and for educators when school in-person classes were not happening. And these can have lasting effects throughout a lifespan. Having said that, I am so proud of the educators, administrators, and staff who've done an amazing job at making this a safe and important learning experience for students across the province. Since the start of the school year, we've paid close attention to our schools, and we've learned a lot, including the importance of having these robust safety plans and using the layers of protection that are built into these plans. We have seen exposures in our schools, and we have reported on those exposures, but we need to remember that these are reflections of what's happening in our communities. And we've followed these and monitored them very carefully, and we've had very little spread within the school setting, particularly within the classrooms. And that is a testament to how safe these are being made by everybody in the school community. Recently, we've had concerning exposures of people who have been infected with variants of concern, and including one in a high school in the Fraser Health region yesterday. And again, the results of the testing that we did out of caution to ensure that we were picking up any transmission showed us that the safety plans that were in place in that school worked, and we have had nobody who was had transmitted from that person. Schools are a reflection of our communities. So I anticipate as we continue to have spread in our communities, we will continue to experience exposures. And that's why it is so important for us to update and reinforce the importance of these plans and these guidelines. So through the work of the Provincial Education Steering Committee and Minister Whiteside has outlined, we are updating the guidelines and procedures for the schools. It includes continuing our layers of protection and reinforcing the importance of these within each school system. We've also established response teams for each of our health authorities to work more closely with public health to support schools on an individual basis when exposure events happen. We've updated checklists and requirements for the school safety plans have been developed so that every school is consistently following these public health guidance. We've learned that when these safety plans are relaxed or provisions are made for some of the higher risk activities, for example, that can increase the risk of transmission. As Minister Whiteside has also mentioned, the mask requirements for middle schools and high schools have also been amended to more closely align with other places in our community. As we know, masks by themselves are not the answer. They won't by themselves stop the spread of COVID, but combined with our other layers, it can make a difference. These are similar approaches to the requirements we have in offices or in restaurants, where you wear a mask when you're moving about, but not when you're seated at a table. The same applies now to our schools, and when students and educators are at their desks or workstations, they may remove their masks, but when moving about, or in the broader school, masks must be worn. Similarly, we've put in guidelines to reduce the potential for transmission when doing some of the higher risk activities that have led to some of the transmission that we have seen, including physical activities, playing instruments or singing, and other activities. I am incredibly proud of how our community has come together to support in-class learning for students across this province. From the very beginning, it has been so important to help our communities get through this crisis. Today's announcement is another step in that. And the focus on the needs of children and families will continue. And I want to thank all of our educators, parents, and students for continuing to do your part as we move through this pandemic phase. Thank you, and I'd like to introduce the BCSTA President, Stephanie Higginson.
It's a bit of a dance doing all this, eh? I'd squail, Aikwana Silam Nala, Entapa Stephanie Higginson, Tlahitsanas Nonemo. I've just provided you with a traditional Hulkaminum greeting, which is a language of the lands upon which my own school district, the Nanaimo Ladysmith Public Schools, is situated. I also want to acknowledge that I am grateful to be on the territories of the Lekwungen-speaking peoples of the Esquimalt and the Songhees First Nations. I too would like to begin by expressing my gratitude for the hard work being done by every member of the education community in creating opportunities for students across British Columbia to continue their education throughout this pandemic. This includes the monumental efforts to create and implement safe, full-time, face-to-face instruction, as well as establishing various remote and hybrid learning opportunities and continuity of learning for students unable to be at school. It's really actually monumental what's happened in this school year. This gratitude is not limited to those only employed in the sector, but includes the families and the students who are working so hard to understand and comply with the robust health and safety measures that are in place in school. I also want to thank the numerous agencies and ministries that have supported the education sector in this important task. Most importantly, the Provincial Health Office. We could not do this without their expertise and their knowledge. Today, Minister Whiteside and Dr. Henry have outlined several changes to the K-12 health and safety guidelines under which schools will have and will continue to operate safely. These updates are comprehensive. They reflect what we have learned about operating schools during this pandemic, as well as what we continue to learn about this virus. They are based on up-to-date science. These updates have undergone a thorough consultation and collaboration across key education rights holders, stakeholders, and partners. The Provincial Steering Committee has over 40 voices participating on it. Committee members who have spent hours together discussing issues, establishing the path forward for how schools will operate. The updates being presented today reflect the collective desire of the Steering Committee members to have as many students in school for as much time as is safely possible during the pandemic. Prioritizing the social, emotional, and educational needs of the young people of this province is something each and every British Columbian should be proud of. This must continue to be a priority for us all throughout the course of this pandemic. Boards of education thank every British Columbian for the efforts that they are making in their own personal lives to prioritize the education of students. As the exhaustion of living during these difficult times sets deep into our bones and our hearts, I have noticed a heightened sense of divisiveness in the way people are expressing their concern about school safety. And this is not about developing thick skin as public figures or as earning a salary as a senior district leader. It is about decency and it is about kindness. For the sake of the students who are watching, we must refocus this energy on the important tasks that we have at hand. Boards of education are listening to their communities and being thoughtful during this complex time. Working together constructively to ensure schools are safe. This is our collective North Star and will remain so for the approximately 90 school days remaining in this school year. This work is important, this work is making a difference, and we must remain focused on the critical task ahead of us. Thank you.
We'll now move to the question portion. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question this morning is from Richard Zussman, Global News.
As you are all aware, a lack of a mask mandate has created a lot of anxiety amongst especially teachers and parents. Do you believe that the policy shift that was announced today will ease that anxiety? And why did it take so long to put in these measures around masks, considering this is something that has been called on now for more than 5 months?
Well, thanks for that question, Richard. And of course, it's very important for all of us that students, their families, and staff feel confident with the safety measures that we have in place. And throughout the pandemic, we have been meeting regularly with our education partners and provincial health officials through our provincial steering committee. And we've certainly been learning as the pandemic has unfolded. We've been learning about the behavior of the virus, and we've been learning what's been working and what hasn't been working in our schools. These K-12 revised K-12 guidelines that we're announcing today are meant to be consistent with the new CDC guidelines. And I would point out as well that we in fact have required that students in the upper grades wear masks in areas where the risk is elevated, in areas of schools where the interactions are not controlled, and that has been an important measure. So this measure today is extending that measure now into learning spaces and into their learning cohorts. And perhaps Dr. Henry, if you
you have a follow-up, Richard?
Just to the point of, do you expect this to alleviate the anxiety that many have felt? And can you explain, Dr. Henry, the science behind not requiring any student to wear a mask while sitting at a desk in a classroom, even in some cases where physical distancing is not possible because of the size of the classroom?
Richard, I'll just address the anxiety question. Sorry, I apologize. I missed that part of your earlier question. I do want to say that we have, and I know that school districts in particular, and those who are really in the schools every day, have been very attentive to responding to the anxiety that we're all feeling. I mean, we are living through an unprecedented global pandemic. There is absolutely anxiety amongst students and staff and their families in schools and across our communities. And it certainly is my hope that the work that we have done together collectively over many months around the safety plans, but in terms of these revisions, very many intense weeks since we returned after the in early January, that this does go some way to making folks feel more secure and confident. And I'll just ask Dr. Henry on the second part.
Yeah, so as we know, there are many different parts of the safety plans in schools, as we have in every other place. And we are not seeing transmission when students, teachers are in the classroom sitting at their desks. We know as well that it's a challenge for young people to wear a mask all the time. For some of them, it's impossible. So it gives people an opportunity when they are in a liaison group led by Dr. Reka Gustafson and Dr. Jeff McKee now at the BC CDC on our behalf to look at what schools needed to help them deal with this situation, because we see more exposures when we have more cases in our communities. And that's why it's so important for all of us to continue to do our bit to stop transmission in our communities. That is what keeps our schools safe as well. So what we learned from that process was that having dedicated places to go, along with a checklist and a response that allows schools to know in a more rapid basis who to connect with and how to do that and what kinds of information will be needed on both sides. That was something that arose out of the consultations that were done by that team over the last few weeks. Yeah.
And just to add to that period, for example, one of the ways in which we were trying to be more responsive in the field was in the Fraser Health Authority. The Surrey School District implemented a new exposure notification process to try to address some of the concerns around communication and around getting more information out. And we found that actually increased the number of notifications that were being sent to parents, and there was a concern that was in fact sort of elevating the level of information and anxiety. And so they went to revisit that. And one of the issues that Dr. Gustafson and her team have been looking at is this question of notifications and ensuring that we have some consistency across the different districts around how that communication rolls out. So it is very much a process of learning what is going to be appropriate and work in different areas. And so I'm very hopeful that the rapid response teams, once we have them, when we have them staffed up and in the different regions, will be able to continue to help just smooth those lines of communication.
Yvette, do you have a follow-up?
Yes, thank you. Sorry, I'm trying to juggle phones here. Dr. Henry, when it comes to vaccine priority, is there any space for case-by-case consideration for somebody perhaps who's not on the list for phase 3 but might be extremely ill, with liver disease or something really serious? Is there any space for that at all?
Absolutely. So what we have done, and if you look at the plan, there's a place for people who are medically vulnerable, and we've defined that with a whole variety of conditions that people have, and it is our intent to most of those people have specialized clinics that they go to and a care provider, and we'll be reaching out to them through those means for the most part. But there is some detail on who is included in that group. I will also say that we have our plan, as we said, built on the vaccines that we have approved for use right now, which are the Moderna and the Pfizer vaccines. And the fact that these vaccines work well in elderly and seniors is something that is, from a public health perspective, quite miraculous even. So even with the limited amounts that we have, this allows us to protect those who are most at risk of having severe illness and dying from COVID-19. We do have other vaccines that are coming down the line, and we're learning more about them, including the AstraZeneca vaccine, Johnson & Johnson, Novavax. And these three are much easier to use. They can be used because they are fridge stable, so we can use our usual channels of immunization in our communities, whether that's physicians' offices or pharmacies or workplace clinics. So we are looking very much at how we can target those vaccines at who they work best in. And what we're hearing is that they will work best in young, healthy people. So that gives us an opportunity, if and when we get these vaccines in Canada, to look at how we can prioritize working age people, essential workers, people who cannot work from home. So that is something that we are paying attention to. It's not about who do we value by whom they work. Right now, the vaccines that we have are only enough to protect those who are most vulnerable, and thankfully they work well in that group of people. So there will be more changes and updating to our immunization plan if and when more vaccines become available. And I just say that today because teachers, of course, and other people in our education system are part of that group of people that we're looking at providing vaccine as soon as we can.
Colton Davies, Radio NL.
Hi, thanks for doing this morning. This question probably for Dr. Henry, and it's also about vaccines. Do we have any indication when or if a vaccine dose could be approved for people under the age of 18? Could it happen this year? And, if that does happen, whenever it does, how significant, in your words, would that be for alleviating concerns right now within schools?
Yeah, so the things that we are learning about this virus is that it does not seem to have as much of a severe effect on young people, particularly children under 10. And we say 10 because that's the age group that most of it has been studied in. But it is a gradation. As we get older, we have more likely to have reactions that are similar to young adults. And we also know that most young adults don't have severe illness or complications from COVID. So that is why the vaccine development has been focused on adults, and particularly older adults. Having said that, the Moderna vaccine is undergoing trials right now in people as young as 12. So there may be vaccines that are available and approved for use for young people 12 to 18 in the coming probably months from now. And some of the more traditional vaccines, unfortunately, some of the ones that were under development have shown not to work very well, so they have abandoned those. But some of the more traditional, what we call protein subunit vaccines, have been used in children for a long time, including influenza vaccines, for example. So when they become available, they may be licensed for use in children. But more importantly, if we think about who's most affected by COVID, it is older people, people with underlying illnesses, and the vaccines that we have now work well in those groups. So it is more, we're more focused on the adults in the school system right now for their protection rather than the children who we know don't get it as often, don't pass it on as often, and thankfully don't have a severe illness.
Do you have a follow-up, Colton?
Yeah, thank you. And again, for Dr. Henry, and on a different topic here, there's at least some nurses at Royal Inland Hospital here in Kamloops. There's a pretty significant outbreak, as you know, of COVID-19 that's in part of that hospital. At least some nurses want elective surgeries postponed there until the outbreak is over. They're saying that staff are stretched thin, so are doing those surgeries, and patients are having to be put in unconventional spaces of the hospital. Is that something that could happen, postponing elective surgeries in this hospital or in any hospital where there's a COVID-19 outbreak?
Yeah, so these are operational issues that are being addressed by each of the health authorities. And yes, that is an option, depending, and we've certainly seen it in a couple of other large hospital outbreaks when it's required. But obviously, we want to continue, and we call these elective surgeries, but they are essential for people. The people are not, their lives are affected if they don't have these surgeries. I know Royal Inland Hospital and Interior Health is working very diligently to figure out what is the best way. I know there's a number of staff who have been ill with COVID and who are off in isolation. We also have been able to provide immunization to protect staff there. So they are looking on a day-to-day basis for the operational needs within that hospital.
Next question is from Tracy Sherlock, Education Matters.
Oh, thank you so much for taking my question. I just wanted to ask why the mask mandate wasn't pushed down to elementary schools as well.
Yeah, so we all know that young children don't get as sick with this, don't pass it on as well as others, and we also, families know very well that it's very challenging for young people to have a mask all the time. And so we still have it optional. We are encouraging families and the school community to enable young people to wear a mask, particularly when they're in environments where they're in groups with others and they're not maintaining their distance. But this is aligned with our mask policy everywhere else, where it's 12 and up. That we're requiring masks to be used. And this is from data that we have from around the world about the importance of other measures, and that masking can be counterproductive, particularly for young people who have challenges with keeping it on all the time or not fiddling with it, and it can cause more challenges in a class setting. Did you want to?
Yeah, sure. And just of note on the elementary, it's important to note that some of the wording has changed. It's changed from not recommended to not required. And it's interesting the impact that one little word can have, and that not recommended was having a bit of an impact in terms of interpretation of medical advice. So it's been changed from not recommended to not required to make it a little bit easier to have that mask encouragement where elementary schools feel that they want to have it.
Tracy?
Oh, can I ask a follow-up?
Yes, please.
I was just wondering about students in grade 6 and grade 7 in elementary schools and what their situation is, because we don't have middle schools everywhere in the province, and yeah.
Thanks, Tracy. And that's an important question, and that was the subject of much discussion at the Provincial Steering Committee around how to organize the sort of upper elementary grades and lower middle school grades, and that is why the guidelines reflect a typology of schools by elementary, middle school, and secondary school, as opposed to age, because it makes more sense for kids to be subject to rules or guidelines that are kind of consistent with the environment that they're in. So, a grade 6 or 7 student in an elementary school will not be required to wear a mask. A grade 6 or 7 student in a middle school will.
Great. We have time for one more question this morning, and that's from Rob Buffum, CTV VI.
Oh, great. Thanks for taking my question. You've addressed the idea that they will not be mandatory for elementary students, but I'm wondering, can you tell us why measures like improved ventilation or lower density in the classroom that teachers, I know, for example, here in Greater Victoria have been pushing for, why were those not included in today's guidelines?
Well, those issues really are covered through the federal funding allocation. On the ventilation issue, we know that more of that districts will use some of the allocation that they get of the second bit of piece of federal funding to ventilation. So far, school districts have changed 45,000 filters. We know that there have been upgrades where the equipment allows upgrade to the more sophisticated MERV filter, and that work has been ongoing since our schools reopened, and absolutely will continue on the ventilation front. With respect to the question of density, I will say that I think that school districts have really been grappling with this question of how to address density in schools, and there are many different ways in which they've addressed the density question. In secondary schools, for example, particularly across the Lower Mainland, we see secondary students in sort of hybrid learning programs where they're in school part of the time and they're learning online part of the time, and that has helped reduce density in schools. There are staggered break times, staggered arrival times to try to reduce congestion at elementary schools, staggering of drop-off and pick-up times, staggering of breaks and such. So there are very many measures that schools and districts have implemented to try to reduce density, and those measures will of course continue.
Rob, do you have a follow-up?
I do, and it relates to just sort of revisiting the latest on consideration of some form of regional approach. Again, the Greater Victoria Teachers Association is pushing for that, and I'm wondering your thoughts on whether that's something you'd consider. For example, if X number of exposures occur in a certain health region, if there might be stricter measures that are implemented there, and if there might be targets that are hit that would mean, if we have a certain number of exposures on the island, then increased measures would take place. What's the likelihood of a regional approach in that regard?
Well, just to start on this, I will say that I think that we've worked very hard throughout the course of this pandemic to be consistent in the approach, and we know that what happens in schools mirrors, of course, what's happening in our communities, and we have seen again very low rates of transmission in schools. So we know that trying to maintain a very high standard of implementation of our school safety plans across all of the districts is very critical to keeping schools safe. So that approach, I think, has been very of consistency, and maintaining strong provincial standards has been very important. But perhaps there might be something you want to add about the. That's, yeah. So
That's all the time we have this morning. Thanks for joining us.